Hello, everyone. A warm welcome to Mount Alvernia Hospital's virtual event this evening, Healthy Tips for Pregnancy and Parenthood. And I'd just like to say a big thank you to Mount Alvernia Hospital for organising the event together with ACJ, Women's Clinic, and the Dietetics Department, Nutrition and Dietetics at Mount Alvernia Hospital, and also to Abbott Nutrition, our sponsors. So without further ado, I'd like to introduce our speakers for this evening's event. Firstly, I'd like to introduce Dr. Jocelyn Wong. Dr. Wong is a consultant obstetrician and gynecologist here at Mount Alvernia Hospital at ACJ Women's Clinic. She graduated with a medical degree from the National University of Singapore in 1996. And she obtained her postgraduate obstetric and gynecology degree from the Royal College of Obstetricians and Gynecologists in the UK in the year 2000. She did her training in O&G at KK Women and Children's Hospital, and she's also a busy mother of 2 teenagers. She's been in private practice for 15 years and has helped deliver over 4,000 babies so far. But still enjoys her job tremendously, as every new birth is special. And fingers crossed she doesn't get called during the event tonight. We think we're going to be okay. Next, I'd like to introduce Jacqueline Lowe. Jacqueline is a clinical dietitian at Mount Alvernia Hospital also. She obtained her Masters of Nutrition and Dietetics in Perth, Western Australia. During her time at Mount Alvernia, she's enjoyed supporting hands-on weaning workshops and antenatal nutrition classes, and has a special interest in antenatal and postnatal nutrition. And she's also kept busy. She's mother to a bubbly 1-year-old. So we'd like to get started with the questions, and would love to see your questions coming in on the Facebook page. So do keep them coming, and we'll hope to answer as many as we can this evening. So perhaps while the questions are coming through, a question for both of our speakers. So we'll start with Dr. Jocelyn first, but should I be eating for 2 whilst pregnant?
For eating for 2, right, you're saying?
Yeah, should I be eating for 2?
Okay, definitely not. Definitely not. It's been a myth that, okay, if you have a baby, you have to eat for 2. But when people do that, when the moms do that, they end up eating too much, and then they put on too much unnecessary weight. I think Jacqueline will know the details, but we know roughly just about 300 calories a day extra is more than enough. And 300 calories, I think that's just like a sandwich. But I think Jacqueline will probably know better than me.
No, Dr. Jocelyn, you're right. So it's just about another sandwich over the day, not an extra full meal over the day. So just a small snack that includes all the right vitamins and minerals that mummies do need during this period.
Thank you, both of you. A question for Dr. Jocelyn. What is an appropriate weight gain during pregnancy?
Okay, let's say you are fit, normal, you're of good body weight, then we generally say total of 10 to 15 kilos over the 9 months. But if you were overweight to begin with, then I wouldn't ask you to put on too much. So let's just say for a 1.6 meter lady, if she starts off 85 kilos, then I will say try not to put on more than 10. But if you were underweight, say only 40, then actually you're okay to put on 15 to 20. So you don't really have to eat a lot. You just eat the extra 300 calories a day. Your weight will automatically go up. You don't really need to eat a lot.
And Jacqueline, how can I ensure enough nutrients for my baby whilst avoiding major weight gain?
Okay, so when we're looking at making sure that we're still getting the right amount of nutrients for mommy and baby during this time, what changes is actually your requirements for things like iron, calcium, your omega-3s, and your folic acid as well. So why we try to focus on those nutrients, because they are beneficial for the mummy as well as the baby. So iron, we know, is good for blood, as well as improving the memory of the baby as well. For calcium, we know it's for bone development, building the nervous system for the baby as well. For omega-3, it's definitely beneficial in fetal brain development, as well as eye development as well. So we want to focus those extra calories, that extra 300 calories, on snacks that actually do provide those special nutrients during this time. And how we can do that is actually by also making sure that we are getting a well-balanced diet from our vegetables and from our fruit as well, and not loading up on empty calories, things like prata or things like char kway teow, things like that.
What would be suitable snacks, Jacqueline? What would you suggest? What would be good choices?
So definitely whole grain biscuits, whole grain breads, things that contain a little bit more calcium. For example, your cheeses, yogurts, milk, even soy milk, if let's say you are vegetarian. So these sorts of snacks do contain the calcium and the iron, especially fortified whole grains. They do contain those particular nutrients that do benefit mummy and baby at this time.
Thank you. And so one for Dr. Jocelyn. How can I avoid being diagnosed with gestational diabetes?
Okay. Sometimes it's genetics. So if your parents have diabetes, chances are you might have the diabetic gene in you. So there's a good chance, no matter how you try, you might still fail our oral glucose blood test. But having said that, of course, let's say you're not prone to it, you're not at risk. Definitely from day one of pregnancy, don't purposely eat too much sugars, don't eat too much carbs, as I'm sure Jack will say. You take too much carbohydrates, they get broken down into sugars. So just cut down all the sugars, the carbs, exercise regularly. Because when you exercise, you burn off all the excess carbs you eat. So other risk factors besides family history will, of course, be age. Again, I have very, very healthy girls, 35, 40, no matter how healthy they try to be, sometimes they still do get gestational diabetes. But if they control well, at least it's just really, really mild, and it doesn't affect the pregnancy.
So one for Jacqueline. I'm overweight. Can I go on a diet, a weight loss diet, when pregnant?
Okay, so with if let's say you are overweight pre-pregnancy, then definitely we want to curb the weight gain, as what Dr. Jocelyn was saying. I know a lot of mummies are scared of gaining weight during the pregnancy, but it's normal. Weight gain is perfectly normal. That being said, the excess weight gain can be hard to lose after pregnancy. So like Dr. Jocelyn mentioned, it is anything more than 10 or 11 kilos if you are within the overweight BMI. Diet control and a well-balanced diet is important, but going on a restrictive diet or low-calorie diet is definitely not recommended at this stage. So you know that baby and mummy, they both need adequate nutrients to grow well, to grow the baby well. And this actually helps the baby to grow physically as well as mentally. And we know now that the first 1,000 days, so when we talk about 1,000 days, we're actually talking about from conception all the way to the baby's first 2 years of life. And good nutrition during this 1,000 days has actually been shown to give them a good head start in life. So no extreme diets during this time.
Thank you. So for Dr. Jocelyn, what helps with morning sickness?
What helps with morning sickness? Okay. Usually because the digestive system slows down. So if they eat a big meal, they will definitely almost always throw up, or they feel really, really bloated. So eating small little meals intermittently. So for example, instead of the usual 3 big meals, eat like 6 small meals. So they tend, but because you eat a small meal, of course, maybe 3-4 hours later, you feel hungry again, but just Just eat, but just eat a small meal. So small, frequent meals will help. A lot of patients feel a lot better if they eat something a little bit sweeter, a little bit more sour. Some suddenly have this, like they have to eat something very spicy, so they need more flavorful food, which is not always very healthy. But then again, if they don't do that, they will be vomiting. So I normally say, okay, you can cheat a little bit first trimester. Just eat something you think you really, really like, and then we'll start the healthy eating after 12 weeks. Yeah, Jack's probably not agreeing with me. Let me see. Yeah, and rest well. So I have noticed that more tired my patients are, they get really, really more nauseated. So sometimes all they need is like a 2-day MC. They rest at home and the nausea is much, much better. So I think tiredness makes it a lot worse. And keep hydrated. A lot of them can't drink water, but it actually gets worse. The more dehydrated they are, the more nauseated they feel. So I always tell them, strangely, they can't drink plain water, but if they add a bit of honey, a bit of barley, a little bit of Ribena, slightly sweet, or maybe just a little bit of lemon, they can swallow the water better and keep hydrated. They can't take big gulps, but just small little sips throughout the day. Keep hydrated. That really helps also.
That's good advice. So for Jacqueline, we've had a question come in. What can my wife eat at Christmas while pregnant?
Oh, almost everything. So a normal Christmas diet it depends on the family structure, I guess, but it depends on what you would typically eat at Christmas. So for some it could be turkey, for some it could be a sushi sort of spread, but your wife can eat almost anything that you would have at Christmas time. Of course, there are certain things, for example, if it was a raw item or a something that is not safe to eat. For example, if it's not fully cooked, for example, let's say maybe steak that is a little bit on the raw side, then of course you would want that particular steak to be cooked fully through before taking it. But the seasoning, all of that is fine. The only thing that probably she's going to be missing during Christmas is maybe the wine. Yeah.
Actually, you're allowed 1 glass of red wine a week. Maybe a sip. Yeah.
And what about the cheeses? So the cheese platter, any cheeses that a expectant mummy should avoid?
Yeah, so you want to be going for the hard cheeses. You want to be going for something without a moldy rind. Things like blue cheese, things like soft cheeses, we generally don't recommend, mainly because of the way it's processed and the increased chance of getting food poisoning or listeria with those.
So for Dr. Jocelyn, how should I deal with heartburn during pregnancy?
Okay. Sometimes the gastric juices just come up when you least expect it. I mean, most of the time my girls get it after eating. So then I'll tell them, well, then don't eat so much. Just eat enough. You feel a little full, then just stop. But let's say they really, you really get the gastric pains. Some just drink a little bit of water or munch down a little bit of bread. They actually feel better. If not, it is okay to take over-the-counter medicines. So there are medication. Okay, am I supposed to name brands? Antacid.
The calcium.
The antacids. They're sold off the counter. They're the liquid ones. They're the tablet chewable ones. So they're very safe. You can just take the antacid liquids or tablets just to deal with the gastric pains. But we do have some girls, they're really, really bad. Then you'll need oral tablets. But by that time, I think you should see either your GP or you see your gynecologist who can then advise you better. And of course, don't eat all the chilies and the acidic things. So don't eat so much chili on an empty stomach because that obviously will make it worse. I had a girl, all she did was Chinese New Year. So she went from house to house. Every house she visited, pre-COVID days, she took one Mandarin orange. And I think she took about 10. And she has such severe gastric pains, she actually appeared at the A&E. So, yeah, I mean, so avoid very acidic fruits. And probably not 10, of course.
So for Jacqueline, what would you recommend to mummies on a budget who feel like eating organic food? Is it necessary to buy organic food?
Yeah, I think a lot of mums are particularly concerned about chemicals, especially the chemicals that they're going to be passing on to their baby at this particular stage. I think at this point in time, though, especially if you are on a budget, a lot of our organic foods tend to be imported. So they tend to have that extra charge because of the shipping costs. And probably the storage cost as well. So actually, I mean, in terms of getting the actual nutrients and the added benefits of these organic foods, I would actually recommend to buy local. It is not it's not very cheap, but it is probably cheaper than overseas organic foods. And if you wanted to find out more, you can actually go to our Singapore Food Agency website. They do have a big range of what's available in the Singapore farms, what's locally grown. We do also do organically, locally grown foods. And with that, I think the good thing is that because it is locally produced, your availability of the vitamins, because they haven't been lost during storage, they're a lot higher with locally grown foods. So there is that extra benefit there. But yeah, if you're keen, they also do have a little sticker on locally produced foods. So if you are in the supermarket, you can look out for that.
So for Dr. Jocelyn, how to deal with leg cramps during pregnancy?
Okay, these usually occur in the 3rd trimester, and almost always is due to lack of calcium. So I always tell my girls, increase your calcium intake. If you're taking 2 glasses of milk, take 3. So number 1, increase calcium intake. Number 2, the cramps always come on in the middle of the night, 4 a.m., 5 a.m. So by the time you got woken up by the cramps, you wake your husband to massage you, it is too late. So get your husband to massage your legs. Just do a quick calf massage before they sleep, before you sleep. And if you sleep in an aircon room, which we all do, cover with a blanket, keep warm. I find it always helps. So increase calcium, massage, keep warm. The cramps will definitely go away. Especially on the days when you walk too much, by nighttime, the legs tend to be a little bit tired, tense. The cramps will come. So on a very tiring day, get your husband to do a massage.
So for Jacqueline, this question's been posted on the chat. What about other kind of alcoholic beverages? For example, beer, which has lower alcohol content. Wine, does wine have a higher alcohol content than beer?
Yeah. So with alcoholic beverages, there's a huge range nowadays. So you can even get beer which has 0% alcohol. So if you're into that, sure, why not? There are also beers with very low alcohol percentage as well, like 0.5%. So if that's your alcoholic beverage of choice, then you can definitely aim for the lower alcoholic content beers. Wine naturally does have a higher alcohol content, and then it goes up with your spirits as well. So yeah, definitely sticking to the lower alcoholic content beverages when you are out or during a festive period. That would be the safest option.
And another question for Dr. Jocelyn. How harmful are X-rays and even computers, laptops for pregnant mums? What if I have had an X-ray during pregnancy without being aware? Or perhaps I work for long hours in front of a computer?
Okay, so X-rays, generally speaking, are more harmful at the very, very early stages when the cells are still dividing, the fetus is still dividing. By 20 weeks, actually, the fetus is more or less developed. Every finger is formed, every heart, lung, kidneys formed. So after 20 weeks, actually, X-rays are pretty safe. Of course, if you are still going for X-rays after 20 weeks, you should still wear the lead shield. So we're probably more concerned in the early stages, especially the 1st trimester. If it's an X-ray of the chest, of the face, of the teeth, actually of any part except the abdominal area, it is actually safe. But of course, generally speaking, if you know you're pregnant, we still say avoid X-rays in the first trimester. But for medical reason, if you have to, just tell the doctor. But if you accidentally had an abdominal X-ray first 3 months, if it was very early, like maybe the baby you were just 1 week, 2 weeks pregnant, chances are, I mean, if the radiation was high enough, you probably will miscarry, which is sad, but not so bad. I think most people are worried about deformities. So that's more like maybe high dose radiation, the 3rd week, 4th week till 12, 14 weeks. But generally speaking, a normal X-ray, the radiation is not too bad. So we don't ask the patient to abort just based on an X-ray. But if she had a CT scan or a CT scan with a dye, okay. But she has to discuss with her gynecologist. But we never tell the patient it's not a good thing. X-rays, I think, computer. So of course we have patients who are very worried about radiation from the computer, from the microwave, from the photostacking machine. I'm not sure where they got all this information from. So then they get worried working for long hours in front of the computer. I don't think there's been any studies that the so-called radiation from the computer is going to travel all the way to the baby. I'm probably more worried about them getting the eyes tired or neck ache. So no, we're definitely not worried about radiation from the computer. But of course, if they're worried, maybe the laptop, don't rest it on their tummies and go typing away. So at a distance like that, I'm very sure it's fine. Some actually ask me, should they buy anti-radiation clothes? Have you heard of that? Okay, they actually sell this on internet. Some form of, I'm not sure if it's a netting or a t-shirt that can apparently block off the X-rays, the radiation from computer. I don't think we have ever had any studies done on that, but well, if your mom wants you to wear it and she bought it for you, okay, go ahead. But we do not believe handphone radiation, computer radiation is going to harm the baby. But maybe just don't put the laptop on your tummy. Have I answered? Yeah. Okay.
Yes, that's reassuring. Thank you. So for Jacqueline, what kind of confinement food is recommended?
Confinement food. Okay, so with confinement food, there's no, I think it's a lot of it is based on the traditional Chinese, traditional Malay or Indian medicine, and there's no actual Western approach to it. A lot of it is based on, making sure that you've removed the wind from the body after the pregnancy, or making sure that the woman doesn't get too cold after the pregnancy. With confinement diets especially, a lot of it can be quite rich. For example, the use of sesame oil or the use of a lot of fatty cuts of meat, especially things like pork trotters, pork belly. So with that, of course, with very rich foods, the tendency is to gain quite a bit of weight. Even though if you're breastfeeding, you're still expending quite a lot of energy. But it is important still to have a very well-balanced diet after you give birth. So things like your vegetables, your fruit, whole grains, that's all still very necessary. But the fattier cuts of meat, the amount of oil that they put into their confinement foods, that's not as necessary. So cutting down the amount of oil and choosing leaner cuts, that's advisable during that period.
Can I just add something? So the really traditional confinement food, for confinement period, my patients are told they cannot drink water, they cannot eat fruits. It's terrible. They all get constipated. And they're only allowed to drink this longan tea, longan red dates, which is fine, but the confinement lady tends to make it so concentrated. All of them are constipated. And a few of them, the urine is so concentrated, they come back and get UT. They get urinary tract infections. I even have some girls, they come with a low-grade fever, and we do all kinds of blood tests. We can't find anything wrong. And then I tell her to drink water, and then the fever goes away. So some of the confinement, I think the foods are fine, but surely please drink water and please eat fruits. Otherwise, I have to give all the laxatives. So I just want to add that.
Yeah, well-balanced diet is definitely very important during that period.
For Dr. Jocelyn, what's the difference in the recovery periods for mums with natural delivery versus C-section?
Okay. So I usually say C-section, the recovery is about twice as long. So let's just start with natural labor. So after delivery, after vaginal delivery, yes, you have a little bit of stitches in the vagina area. It is painful. So maybe on average, the girls take painkillers for about 3 to 5 days. But for cesarean, the incision is of course longer. So they take painkillers for 6 days to 10 days. So double the time. After normal delivery, maybe after a week, they can go for massages. So girls like to go for these wraps and massages. So 1 week later, they can because it's not so painful. But for cesarean, 2 weeks. After normal delivery, if they really want to start jogging, exercising, 4 to 6 weeks. Cesarean, 8 to 12 weeks. So again, it's double. So if everything is okay with the pregnancy, we still think normal delivery recovery is faster. So we prefer natural birth.
Thank you. So one for Jacqueline. My gynae just confirmed my pregnancy of 3 weeks. Should I stop my keto or ketogenic diet or continue? Or is it okay to continue? What are the side effects?
Yeah, so definitely I would suggest to stop the keto diet and go to a more traditional sense of diet. So getting your fruits, getting your vegetables, getting your carbohydrates, which is the number one thing that stops in a keto diet. That's all very important for the baby's development. Usually on a keto diet, it is fairly strict in the sense that you do have to limit even the amount of fruit and vegetable because of that carbohydrate portion. And how you get your main nutrients, especially things like your calcium, your folic acid, is from these items. So yeah, I would suggest to stop the keto diet for now. And then once you're actually, once you've given birth and once you've started breastfeeding, then you can actually commence that keto diet.
So one for Dr. Jocelyn. Is it true that after delivery, most mums get diastasis recti or split abs? How do we prevent this? Can this be healed?
Okay, not everybody gets it. Okay, maybe everybody gets a tiny bit of split abdomen, the split muscles, but generally most of us will just recover if your tummy wasn't expanded too large. But we do have like our twins or the moms who really ate too much and the abdomen was over distended. 6 weeks later, when they come for the checkup, we can tell if the diastasis rectus is there. I mean, if it's very mild, it's okay. But if it was quite bad, it can be improved with physiotherapy. So then I will refer them to the physiotherapist, do some special exercises to try and bring the ab muscles together. Only in the very, very, very severe cases, like maybe the triplet pregnancy, then they need to see a surgeon to get the rectus stitched together. But I would say it is very, very uncommon. Almost always muscle exercises, physiotherapy will help. So the key is don't put on too much weight, then you won't loosen the muscle.
Yeah. So one for Jacqueline. Is it true that what I eat during pregnancy may affect the allergy risk of my baby?
Okay, so for allergies, there actually isn't any evidence to show that staying away or restricting your diet during pregnancy increases the risk of allergies. There is some evidence to show that the exposure of these common allergens whilst the baby is still in the womb, or even exposure through the breast milk, can reduce the risk of the child developing an allergy. So it's definitely not recommended to stay away from the major allergens unless you do have a family history of food allergies.
Thank you. So for Dr. Jocelyn, if I have eczema, can I pass the eczema to my baby?
Oh, eczema. Okay. Yes, because eczema is actually a genetic problem. I mean, so if you have eczema, your mom has had eczema, your brothers have eczema, chances are you will pass the gene to your baby. But if your husband doesn't have, and then you hope the husband's gene went down to the baby, we can't really prevent eczema if your child got the gene. But we do know, I think Jack will also know, by adding probiotics to your diet while you're pregnant, apparently seems to suppress this eczema gene, so that may help the baby not develop eczema. And of course, if the mother is able to do breastfeeding, full breastfeeding, that also helps.
Thank you. So one for Jacqueline. I often feel lethargic. Can energy drinks help?
Yeah, it's very common for mummies to actually feel lethargic during the pregnancy, mainly because of hormonal changes. Your body is also working extra hard to produce more blood, more fluids to support your baby. So, I mean, sometimes it can also decrease your blood pressure and also your blood sugars, which is why you probably feel also quite tired. So energy drinks usually consist of some sort of quick-acting carbohydrate, something like a glucose or a sucrose, and then it's combined with caffeine or a substitute for caffeine. If you've heard of things like taurine or guarana, these are some things that actually improve energy levels, and these are actually not recommended during the pregnancy. So how can you get the energy back? Really, getting the rest that you need, so sleeping when you can, and then also getting your energy from nutrient-dense food as well. So it comes back to the whole grains, the vegetables, the fruit, your good sources of carbohydrates. If not, maternal supplements can help as well during this time, especially if, let's say, you are feeling nauseous or having severe reflux, not able to eat very much, then that's where it can be useful.
For the first 3 months, actually, a lot of girls are tired. No matter what they do, they'll be tired. So energy drinks, of course, we don't encourage. Then some of them will drink coffee, which, of course, we don't encourage also. So the first 2 months, the tiredness, I tell them, there's nothing much we can do. It's just part of the fatigue from the first trimester. So just get as much rest as you can. But if by the third trimester, they're getting more and more tired, actually, a lot of Asian moms are low in blood count, you know. So we've started to check their blood counts again in the third trimester, and we found majority, I think at least more than half of my girls have low blood counts. So compared to the blood count at 2 months and at 7 months, a lot less. So despite them taking their multivites, or maybe they forgot to take the multivites, I think a lot of our Asian people don't eat enough red meats. So they're always saying tired. We used to say, oh, you know, third trimester, everyone's tired. But now we realize actually a lot of them are anemic. So just remember to take foods rich in iron. I think that helps also.
And Jacqueline, which foods would you recommend as rich sources of iron?
Yeah, so rich sources of iron, especially if you do eat meats, that would be the best source of your heme iron, or the readily absorbed iron. So things like beef, things like mutton. If you don't eat beef or mutton, then things like duck or the darker parts of your chicken. Those are rich in iron. If you are vegetarian, there are sources of like beans or lentils that are also rich in iron as well, vegetable sources of iron, but those don't get absorbed as well as the animal sources of iron. So it is important to actually take vitamin C with those vegetarian sources. Any fruit will do, tomatoes even, that helps with the absorption of vegetarian sources of iron.
So one for Dr. Jocelyn, what is the recommended sleeping position throughout pregnancy?
First trimester, any position. The baby's still so tiny, your tummy's not showing. You can even sleep on your front and nothing will happen. The baby will not be compressed. But by second trimester, the tummy starts to show. I would just tell my patients, okay, don't lie on your tummy. But you can still sleep on your back. It's perfectly fine. But by third trimester, the tummy is a lot heavier. So if you lie on your back, you know, because our spine curves upwards. So if you lie on your back, it presses down on your spine. So a lot of my moms wake up the next day with backaches. So I would say third trimester, lie on your right or on your left. Or if you have to lie on your back, then put two pillows, angle yourself about 45 degrees so you don't get the back pains. Then a lot of girls will check the internet and then they go, oh, the internet says on the left side. Okay, true. From anatomical point of view, we do have a big blood vessel called inferior vena cava, which is situated a little bit more to the right. So some women are worried that the big uterus will compress that blood vessel and then reduce the blood flow, the circulation of the oxygen to the baby. So then they'll follow on the internet, and then they'll sleep on the left for 9 months. But then they end up with left-sided pains, left-sided aches. So I'll tell them it's okay. Third trimester, sometimes left, sometimes right. In fact, within one night, the lady has to toss and turn, because maybe she goes to sleep on the left side. 3 hours later, she wake up aching on the left, then just turn to the right. We have never seen any woman lie on the right side or on her back, and then the baby becomes like oxygen deprived. We have never seen that. But a lot of moms are worried. Have you all had that worry?
Yes.
Anyway, I have a lot of moms always sleeping on the left side and then coming to complain about left-sided pain. So I tell them it's okay. You can sleep on the right. Yeah, maybe just not on the back.
So one for Jacqueline here. Are cooling foods like grass jelly, papaya, pineapple, kangkong harmful to the developing baby? Is that true?
Okay, so again, there's no real scientific evidence that these cooling foods should be avoided when you're pregnant. If you do wish to reduce the frequency of these types of foods, because you're getting a lot of information from family members, especially the older generation, do ensure that you're still getting adequate portions of fruits and vegetables from other sources. So try not to be too restrictive in terms of your choices. That way you still get your big range of vitamins and minerals necessary for the pregnancy.
Yeah. And one here for Dr. Jocelyn. I've read that vaccinations have certain side effects, even causing autism. Can I or should I reject these vaccinations?
Okay. From the medical point of view, there has never been any definitive study confirming autism from the vaccines. I think there was 1 or 2 studies, but they were finally, when they were reviewed by other doctors, it was flawed. So if you're talking about vaccinations for the mother, so in pregnancy, we encourage whooping cough vaccination and flu, but it's not compulsory. So if you don't really want the vaccinations, it's fine. But for the baby and for the child as he grows up, immunization is compulsory in Singapore. So if you don't vaccinate, he can't even go to preschool, he can't go to school. So I don't think you have much choice if you reject. Then you can't, the child can't go to any school in Singapore. So it's compulsory for the child.
So we're going to move on now to some, not all, but some of the questions will be more related to post-pregnancy and weaning. So for Jacqueline, what signs are there that my baby is ready for solids at around, say, 6 months or so? What signs should I be looking for?
Okay, so typically we're looking at a few signs. One is that the baby can sit up well without support or with minimal support. So the baby is able to hold their head quite steadily without that support. And we want this because then that's the safest way to actually feed your baby without that risk of choking. The second thing is that the baby has actually lost the tongue thrust reflex, so something like this sort of movement, and doesn't automatically push out solids out of his mouth. Also, another thing that you look out for is probably the excess in drooling as well, although drooling may be a little bit of a difficult one to identify. But when you see your baby during mealtime, especially your own mealtime, your baby has a piqued interest in whatever you're eating. So that could be just following the food to the mouth or looking at the food for very long periods of time. Having 2 or more of these signs generally does mean that your baby is ready to start solids.
Thank you. And for Dr. Jocelyn, what about traditional Chinese medicine during and during pregnancy and post-delivery? What is your advice?
Get the medicines from a proper physician. So not your mom go and buy her own concoction. So if you're actually seeing a Chinese physician who has a proper shop and everything licensed, I have no qualms. So actually, a lot of our patients do seek TCM help to get pregnant, and they do a good job. So I actually do believe TCM does have a role to play. First trimester, some of my girls do get the TCM medications to help support the pregnancy. Sometimes we also give medication. So I usually tell them TCM meds, our meds, 2 hours apart. And then after delivery, a lot of our Chinese actually still go to TCM and get all the herbs. I haven't really seen any problems, but okay, occasionally I do feel some women, they're just not suitable. So if they are bleeding in the first trimester or after delivery, they seem to be bleeding more, then I would still say maybe we just stop the TCM first. But other than those few cases, actually a lot of our girls do take TCM and I do not see any problems at all.
So another one for Jacqueline. My baby constantly gags on food of any texture. How do we overcome this?
Yeah. So gagging is actually a very common mechanism, and we should be glad that the child is able to do this. It just prevents the baby or the child from actually choking on the food that he's not able to manage. To overcome particular textures in general that the child has a problem with, we try to use sensory food play. And this can be useful in assisting a child to overcome the fear of a particular food. So sometimes the gagging could be a fear as well. Alternatively, we can actually incorporate some baby-led weaning, which is nowadays very common, if not modified baby-led weaning, so where the adult holds on to the food and then lets the baby take the food and then the adult pulls away after the child has taken a bite. So that can be useful in exploring different textures as well, although I know people who believe in baby-led weaning, sometimes they don't believe in this modified baby-led weaning method. But our take is that we should always try to expose our baby to as many textures as possible so that they don't become picky eaters later on in life. So these are some ways. If let's say, you do notice that the child is gagging quite a lot and it's very frequent, we do have feeding therapy classes that we can actually assess the child to see whether there might be some underlying issue as well. So at Mount Alvernia Hospital, we actually do this particular class with a speech therapist as well as a dietitian in combination, and it's called the Feast Clinic. So we actually do assess these swallowing difficulties.
Can I bring a 16-year-old to assess, Jack?
16. Oh no, I think that might be too ingrained already. Too late.
I think I'll just scold her. Okay.
Yeah.
So one for Dr. Jocelyn. Should I be worried if my baby is not as active as she usually is when stimulated?
Okay. I usually tell my patients, because you only see the doctor once a month. So in between, how do we monitor our baby? I mean, the only way is to make sure he's moving. But of course, we don't expect babies to move the whole day. Generally speaking, every 2-3 hours, he should move. We are usually at work. So I think the only times we actually notice if the baby's moving is at night. And a lot of babies tend to be more active at night. So let's just say his usual active periods are like 10 to 11. But if there's one night he absolutely doesn't move, I actually do tell my moms, try to stimulate the baby. Either shake the tummy a little bit, take some sweet things, ask daddy to shout. And if really after another 2, 3 hours, 4 hours, not a single movement, should come for a check. Almost always, as soon as they reach the hospital, the baby moves and everything is fine. But I mean, very occasionally, very, very, very occasionally, we have picked up problems. And then if the mom does come early enough, sometimes we can do something about it. And in any case, let's say the mom can't elicit any movements at all. She's probably worried the whole night or so. So if she's really, really worried, just come down to the hospital. She doesn't need to see the doctor because in the labor ward, the nurses have the machine to listen to the heartbeat. So as soon as they hear the heartbeat, suddenly the moms will feel the baby's moving. So then she goes home happy. I'm not saying 4 hours the baby doesn't move calm. What I mean is like I think within 6 to 12 hours, surely there should be a movement. But if there's absolutely no movement, 6 to 12 hours, you should come down for a check.
Thank you. So one for Jacqueline. My 4-year-old toddler cannot stop snacking. Should I be worried?
I think it's very common for toddlers to feel very hungry. They still need a lot of nutrition at that point in time. And if your toddler is a very active toddler, then it is probably quite normal. I think more so if you are worried, you should be looking into their main meal times. It could be that the toddler is not having very much during their main meals, and that's why they're excessively snacking, especially at this age where they're all at nursery or kindergarten. Sometimes they might just not eat as well when there's a lot of things going around. They're easily distracted. So it could be that. So you'd have to look into that. But other than that, not too much to worry about.
So one for Dr. Jocelyn. My mum says that I should not bathe during my confinement period. Is there a scientific reason for this?
Absolutely none. Absolutely. Okay, so there's this Chinese confinement belief that we shouldn't bathe, not because they want the mom to be dirty, but okay, this is a very old Chinese tradition. I believe originated in China, where there's winter, and I mean 100 years ago, you're not going to get warm water from the tap. So if you just delivered, the mom is weak. That I agree. So and I think in winter and cold weather, nobody sweats anyway. So therefore, they tell their moms not to go for a bath. Maybe they bathe in the lake, it's cold. So no bathing because they don't want the moms to get sick from the cold water. We are in Southeast Asia. This is a really hot country. I mean, I'll bathe 3 times a day if I had the time to. And after delivery, the mom is usually very, very hot. We're always perspiring from the breastfeeding. So if you don't bathe, it's really not very hygienic. So it doesn't make sense. Before we carry our baby, we tell the mom, please wash your hands, before you touch the baby. And then my mom doesn't bathe for 1 month. And she's sticky. Her hair is sticky and plastered to her head. And then she carries her baby. So no scientific evidence at all. I mean, in Singapore, you're not going to catch a cold from bathing because this is a tropical country. We bathe with warm water. We dry our hair. We blow our hair dry. So no problems about wind going into the body. So no, absolutely no scientific evidence. Of course, if we have some grandmoms watching this chat at this moment, they'll be very angry with me. So at the end of the day, I do tell my moms, well, to keep the peace, if your mom refuses to let you bathe, okay, at least make sure you wipe down. You really, really have to wipe down. Yeah, it's completely not hygienic to not bathe for a month. Yeah. Please bathe.
So another one for Jacqueline here. When is a good time to let my toddler take sweets or sugary foods? Is that okay to let them have sugary foods?
Yeah. So after the age of 1 year old, generally we would say that it's okay to start introducing sugar or honey into the diet. But then again, of course, we are not aiming for excessive amounts of sugar. So all of this should really be infrequently. So for example, things like cakes, cookies, candy especially, these should be taken as infrequently as possible, not only just because of, we don't want the child to put on excessive weight from empty calories, but also their teeth as well. So oral health is very important. And at that age, kids don't really know how to brush their teeth very well. A lot of the times, teeth brushing is usually a fight. So we want to make sure that we're preserving the oral health as well for that. So
another question for Dr. Jocelyn. So in different cultures, there might be different practices, but I've heard that when a baby is born, nurses do not wash the baby and give the baby directly to the mother. Is this true?
There are some studies to show that when the baby is born, as she passes through the birth canal, the mother is supposed to have some good bacteria. So if the baby catches the bacteria through the birth canal, we should leave it on the baby for a while before washing her, so that she gets like the immunity from this good bacteria. So we have, I think so far my Caucasian patients do not like their babies being bathed for 24 hours, so that the good bacteria stays on the baby, and they hope that they form part of her natural microflora. Chinese are the opposite. They please clean the baby, because I don't know, we just want the skin to be very clean. Sorry, not only Chinese, actually, so for all the Asians, yeah, when the baby comes out with the vernix, they go like, ee. And but some of the babies are born with beautiful, very clean skin, no vernix at all. And the belief is that they drink coconut juice. Have you heard this one? Yeah. Drinking coconut does make the baby come out with hardly any vernix, so they're very, very clean. So there are some medical studies to say that by not washing the baby so soon, the good bacteria can stay. But as I said, I think all these years, no Asian bathes the baby 24 hours later, and I don't really think most of us are a lot less strong, so I'm not sure. So I leave it to the patients. I mean, if they want to bathe, they bathe. If they don't want to bathe, I think the nursery nurses are happier still. You know, they have one less baby to bathe. So I really, really just leave it to the patient. Yeah.
The personal choice.
It's a personal choice. Yeah.
Another question for Jacqueline. What about caffeine? Is coffee consumption bad during pregnancy?
During pregnancy, okay. So for caffeine, there is a limit of about 200 to 300 milligrams of caffeine in a day. That usually means 1 cup of coffee or 1 cup of tea. But then again, we do have to make sure that other sources of your diet don't contain caffeine as well, because things like Milo, things like chocolate also contains caffeine. So everything in moderation, really. But for the coffees, for the items that are definitely heavily caffeinated, then you would stick to 1 cup.
Okay, so another question for Dr. Jocelyn. How soon can mummies resume their exercise routines after delivery? And does exercise affect my breast milk supply?
All right, if we're talking about exercises like jogging, sit-ups, we usually say 6 weeks, because right after delivery, a lot of our pelvic floor muscles, maybe the rectus abdominal muscles are still weak. So if you exercise, then you're actually overstraining and you're probably injuring the muscles even more. We usually see our patients 1 week after delivery and at the 6th week. So at the 6th week, if your doctor has checked you and she says everything is good, you can start exercising. What was the other question?
And does it affect the supply of the
Yes, actually, if you over-exercise. So I have my exercise fanatics. They go to the gym, they work out for 1 hour, they sweat it all out. And then that day when they go back to pump, you will actually see a drop in the milk. But so I usually tell them don't over-exercise. I think just do a light jog, a swim. That's fine. I mean, but you monitor. If you pump your milk and the supply drops, then don't overdo it. We also have girls after exercising, because the body produces a lot of lactic acid, the taste of the milk might change. So the baby may not like it. So I think exercise is good, but don't overdo it.
So one for Jacqueline, is maternal milk a good way to help improve the nutritional quality of my diet?
Yep. So a maternal milk supplement definitely can be used in combination with diet to provide some of the essential nutrients for mommy and baby during this time. And I think more so it has its role where if mummies have difficulties obtaining a well-balanced diet, for example, if let's say maybe because of their work schedule, they can only eat at hawker centers or catered foods or takeaway meals, then definitely it can provide those extra nutrients during this time. For example, you can use it as a meal replacement for something that is a little bit unhealthier. So let's say for vegetarian mummies as well, where it can be difficult to achieve the adequate calcium or omega-3, then these maternal milks also have its role there.
So another question for Dr. Jocelyn. How can I manage my emotions during and especially post-pregnancy, sort of baby blues? Is there anything I should take note of? Is there any medication to help?
Sorry, I didn't catch it. How can I manage my
emotions?
Emotions.
Post-pregnancy with baby blues, is there any medication to help me cope, and are they safe?
Okay. First and foremost, you must get enough sleep. I think half my moms get postnatal blues, probably half. And the half that get postnatal blues is because they're so tired. They have no help, no mom to help, no in-law to help, or no confinement nanny, no helper, just mom, baby, and a dad who's sometimes not very helpful. So they are so tired, breastfeeding, changing diapers, trying to take care of the baby, trying to understand the baby. They are so sleep deprived that the emotions just break down. So number one, always get enough sleep. Number two, as I mentioned, get help. I think a lot of women say, I want to do it on my own, but it's really tough because sometimes you get the cranky babies. Some babies are very angelic, you know, they just sleep, they drink, they sleep, they drink. But we have the tough ones, the colicky ones, they're always crying. And as a new mom, sometimes you can't tell, are they crying for milk? Are they crying because they're sick? Are they crying because all they want is a cuddle? And when they can't figure it out, the baby's crying, they get more stressed, and then the emotions break down again. But with help, and it's good to get someone who's experienced, who can tell and teach you, you know, like, okay, actually all he needs is a cuddle. So if you have help, I find the emotions are definitely a lot better controlled. Okay, so number one, get sleep. Number two, get help. Number three, if everything fails and you're very depressed, you're crying all the time, thinking of not so nice things, suicidal thoughts, of course there are medications. And are they safe? Yes, there are medications that are safe for breastfeeding. Or sometimes the psychologist, the psychiatrist would tell them, take the medication, pump the milk first, take the medication, then for 2 hours, don't breastfeed. So there are medications that are safe. And it doesn't mean that you have to take the medications for long term. So I do have a lot of people who are obviously clinically depressed, but they just refuse to get help. They refuse to see their psychiatrist because of the stigma. And they keep thinking that once they start the medication, they are going to be hooked onto it. No, it's just temporary. And there are medications that are safe for breastfeeding. So if you really feel very, very down, speak to your gynecologist. She can refer you to someone. It could just be a counselor, just someone to talk to, or in the really, really bad cases, to the psychiatrist. Yeah. It's a very real problem, actually.
So another question for Jacqueline. I can't breastfeed and my baby is lactose intolerant. What are the alternatives?
Yeah, so nowadays we live in a world where we can get formula so readily available to us. There are lactose-free or low lactose, milk supplements out there for babies. So you can find those in the supermarkets, and they're readily available.
Thank you. So another question for Dr. Jocelyn. Is it common to have a bleeding nose during pregnancy?
In pregnancy, because of all the hormone changes, right? Actually, a lot of our blood vessels get very sensitive, fragile. So we have a lot of girls, they blow their nose too hard, they have a nosebleed. They brush their gums too hard, they get gum bleed. They get a little bit constipated, their poop is too hard, they get a bum bleed. So yeah, it's actually very, very common. It is harmless. So of course, if you have a nosebleed, just tilt your nose back. Tilt your head back and press, and it almost always stops. Well, I've had a few girls, they keep getting nosebleed and quite a fair bit. There's just one leaky blood vessel. So I just sent her to the ENT surgeon, and they just do this little laser to burn the vessel, and they're fine. So yeah, nosebleeds, any bleed is actually very common.
Thank you. So another question for Jacqueline. Are there any foods mummies can eat to increase breast milk volume and achieve exclusive breastfeeding?
Yeah, we do get this question a lot, and I think that's the one pressing question on a new mummy's mind is how to achieve adequate breast milk. And there is something called galactagogues, and these are substances which actually increase the breast milk supply. But I do have to emphasize that these supplements usually have to be done in combination with regular breastfeeding. So galactagogues, usually they include a whole range. They include fenugreek, they include milk thistle, brewer's yeast, oats. All of these have been actually researched extensively, and then also nowadays they're using them in cookies, lactation cookies, and things like that. But yeah, so even taking those lactation cookies, we still have to bear in mind that there is a correct dosage to how much these galactagogues will work for you. And if you're not going to be adequately hydrated, and if you're not going to be constantly latching on and breastfeeding, then the breast milk is not going to come the way that you want it to. So definitely those three things in combination does help breast milk supply.
Thank you. Another question for Dr. Jocelyn. What are the overall body changes that I should look out for and note during and after my pregnancy? So changes to expect.
Well, of course, your belly will start showing. Usually by 4th month, there will be a little bump. Your friends can't tell that you're pregnant, but they'll start to suspect. Or else they think you put on weight. So 4th month is the time when people start to suspect. By 5 months, it's a little hard to hide. So, and then of course, by 7 months, 8 months, the tummy just balloons out. So, but besides the tummy growing, actually we pad up with a lot of fat. So the arms, unfortunately, will grow. The breasts, of course, will grow in preparation for breastfeeding. The hips will grow. Everything grows, sadly. But some people are lucky. I really think it's the genes. Some of my patients, they have absolutely no body changes at all. So their arms, their face, everything stays the same except the belly. So as soon as they deliver, if they hadn't put on too much weight, they slim down almost immediately. And then I look at their moms, that means the grandma, and they're slim. So I think it's a bit genetic. Well, I'll blame it on the genes. If you look at your mom and she tells you after delivery she looks like this, then okay, we're not much hope for us. Yeah, so everything grows. Even the face grows, your hands grow, your feet grow. But a lot of time, if it's just water weight, you should lose it. You should lose it. But we do pad on the fat on the arms and the bums and the hips. So hopefully we lose it after delivery. But that one you have to exercise. Other changes, pigmentation. So if you get pregnant, a lot of us get this central brown line that goes down the tummy, linea nigra. Not everybody gets it, but a lot of people do. Or like where the necklines are, the armpits, even the thigh area, the inner thighs, it turns out brown. So that's normal. It's not dirt. The belly button turns dark brown. That's normal also. Or if you had a rash and it heals, it always heals with a brownish scar pigmentation. So pigmentation is quite common in pregnancy. So that's another change. Other body changes. I mean, mostly these. You become more curvaceous, yeah, I guess.
Thank you. Another question for Jacqueline. Are all fruits safe for gestational diabetes? My doctor casually mentioned to avoid grapes. How about bread, pasta, and rice? So the sugar or carbohydrate content should I keep a lookout for on such foods?
This is a heavy question. Okay, so for fruits, we always say that to get the widest range of nutrients and minerals and vitamins possible, we shouldn't be avoiding any particular fruit. Of course, with any fruit, though, there is a portion that we try to stick by. And usually for fruit, we recommend at most two fruits per day. So that would mean when we're talking about a serve of fruit, we're essentially talking about, let's say if it was an apple, a pear, or an orange, something that is roughly about fist size, or what we call a tennis ball size is suitable. If let's say we're talking about sliced fruit, for example, things like a watermelon, papaya, pineapple, generally it's no more than one slice of watermelon, or a thin slice of papaya or pineapple would be considered as one serve as well. Things like grapes, grapes are actually a medium GI sort of fruit, so it's still actually fairly safe to take. Roughly about 8 grapes is suitable in a sitting. So grapes are generally okay, but of course, if you, for example, something like a durian, durian is just one seed. If you have trouble sticking to that one seed, if you lose all control once you take that one seed, then might as well not take it. Prioritize a different fruit instead. With regards to the second half of the question, which is the bread, pasta, rice, definitely carbohydrate control is the key in GDN, gestational diabetes. We do want to make sure that mummies still get carbohydrate though. So we tend to prioritize nutrient-rich carbohydrates, so things that are going to be providing the minerals and vitamins. So whole grains, complex carbohydrates, things like sweet potato, potato with the skin on, yams, quinoa, barley. These are all more nutrient dense than your refined carbohydrates. But ultimately, portion is still important. For further information about the sugar content, that sort of thing, it probably does require a little bit of more in-depth explanation by your dietitian. So it would be good to actually book in an appointment with a dietitian.
Thank you, Jacqueline. So we're going to actually ask the last sort of few questions now. The last question for Dr. Jocelyn. What's your advice for a healthy and safe pregnancy? Are there any tips for new mums to get their glow back?
Okay.
So overall tips to pass on to mums.
I think even before you're thinking of getting pregnant, go and see a doctor first. Just get your regular checks, get your blood test done first, get an ultrasound scan if you can to make sure there are no growths in the uterus. Because we have women who haven't had tests done, and then they get pregnant and they come to see us, and then we suddenly discover a problem, which we can't fix because she's already pregnant, and then that complicates the pregnancy. So first and foremost, if you're thinking of having a baby, actually best is to go and see a doctor first and get checked. But if you're already pregnant, of course, go see your doctor as well. And the fact that I think all of you who are logged in here means you're already trying for babies or already pregnant. And again, as I said, the fact that you're logged in means you're actually interested in finding out how to have a good pregnancy. So I think that's a good start. In terms of food, I mean, at the end of the day, it's all about balanced diet. Don't eat too much of anything. Get your exercises. I mean, nothing fanciful, your walks, your swims, your yogas. Don't eat excessively. Eat healthily. Be happy, stay happy. I mean, emotions go up and down. So yeah, to always stay happy. I find when you're happy, then you don't get so stressed. Healthy, safe, good to get good nutrition. Yeah, I mean, like I said, balanced diet. I have a lot of girls who work very, very hard. I mean, work very long hours. So they sometimes skip their lunch, or they only have their dinners at 11 p.m. and then they go to sleep. Of course, that's not very healthy. So not only eat healthy, but do eat at regular timings. I think that's that's very important.
And you've also very much stressed the importance of sleep, the importance of sleep this evening. Yeah. So to wrap up, from Jacqueline, what's your advice, your overall advice for a healthy and safe pregnancy? Are there any tips for new mums to get good nutrition for themselves and child on a day-to-day basis?
I think that making healthy choices during pregnancy is a great way to kickstart good habits, not only for yourself, but also for the family in the future. And I think most people generally nowadays have that basic knowledge on how to make good choices. So kids also tend to pick up on your dietary habits as well. So right now, while you have the time, while the baby's still inside and not running around outside, it's actually good to try out those healthy habits for yourself. And it also benefits the baby and gives them a good head start in life. So it's really a win-win situation. For those with more restrictive diets, however, due to either medical conditions like gestational diabetes or religious beliefs, definitely a dietitian consult can help if you are concerned that you're not able to get the adequate nutrients during this time. For mummies, this one, being a new mom, I can understand, the reliance on quick and easy food, especially when you're tired, when you're stressed, and if you need a baby, if your baby's demanding attention, or if you're feeling super hungry all the time. So I think when that sort of situation is in play, getting organized is very important, even though you might not be organized to start off with. So when you have the time, definitely prepare in bulk, whether it just means preparing one part of the meal first, so cutting up the meal and prepping up the right size portions, or whether it means doing the whole lot, cooking and then freezing into small little portions for you, yourself, your family, and your baby as well. And also what's important is that having nutrient-dense snacks as opposed to chips, candy in your pantry tends to help curb the weight gain. And it also helps if the whole family is on board as well. So I know nowadays we do live in a lot of, multi-family homes. So your grandmother, your mom, your mother-in-law, all of that is in the same house. So that tends to be difficult, especially when everyone has different food preferences. So trying to get everybody on board on the same track helps as well.
So, Bridget, I can't hear you. Can you hear Bridget?
No, I think she's muted.
Sorry. Like to say a big thank you to all of you for logging in this evening to our Facebook Live event. And a thank you to our organisers, Mount Alvernia Hospital, ACJ Women's Clinic at Mount Alvernia, the Nutrition and Dietetics Department at Mount Alvernia, and Abbott Nutrition, our sponsor. So with that, I'd just like to wish you all a lovely rest of the evening and a very happy Christmas and New Year ahead.
Thank you.
Thank you.